Morning and happy Monday. Happy Medicare Monday, I should say. So, I am Melanie Garland, and I am joined by my lovely co host this morning, Mrs. Susan Spilly. Hi, Susan.
Good morning, Melanie. Good morning, everyone. Thanks for joining us.
Yes, and our third host is missing today, so we just want to wish her best wishes as she's recovering and resting at home. And we just want to give a shout out to Megan. So hope you're doing good today, Megan, and we can't wait to have you back. All right. So today's topic is we're starting our first episode, our first presentation of our series of Medicare and Friends. So the purpose of this series is to talk about different health cares, different health services and coverages that you might be eligible for or qualify for, and learn how they coordinate with Medicare. So today's topic is going to be VA benefits and some other things kind of under the VA umbrella that can coordinate, you may qualify for, and just to learn more about how that's going to work with your Medicare health coverage. So, whether you're not on Medicare yet and you may be transitioning to Medicare, or you're already on Medicare, hopefully you can learn about some services that you may be eligible for and not using, or better understand how you are eligible for, you may be using them, and maybe learn some more about how the two work together. So without further ado, we're going to let Susan dive into that presentation.
Thanks, Melanie. And
Absolutely.
folks, feel free to comment in some questions, and we'll take those. And just remember, if we don't know the answers, we'll find out, and then we'll repost them. Okay, so first of all, let's define a couple of terms. As a veteran, there are several governmental sources from which you can get some health care insurance type benefits. First of all, let's talk about TRICARE for Life. This is for folks who have retired from the armed services and who have Medicare. So most of these folks are 65 and older, but of course we know that Medicare does serve younger people, but you have to be retired from the military. There's another kind that sounds like this. It's called TRICARE, and that's for active duty military personnel. So TRICARE, if you're in the services, active duty, TRICARE for Life, if you're a retired person. Then there's the Veterans Administration, and va.gov is their website. So it's a federal thing, although each state also has its own Veterans Affairs department. So Veterans Administration provides benefits to veterans at VA facilities. And it's for really most veterans. But as anything that's federally funded, it is budget dependent. So throughout the years, there have been sections of veterans who have had to lose some coverage and some services at a VA facility, or increased at a VA facility, or made some modifications to make it more flexible for veterans. So it's not a for sure thing like TRICARE for Life and Medicare are, but you can get a lot of healthcare services through the Veterans Administration. Now, it also depends on this thing called a priority group. And once you apply to get healthcare at a Veterans Administration facility, they will assign you a priority level. And if you are one priority, you might get everything you need. And if you're a different priority level, your benefits may be slimmer. Then we have our best friend, Medicare. You know, that's what SHIP is. We're experts in Medicare, but it also behooves SHIP counselors to have a working knowledge of how Medicare works with different types of insurance, hence our Medicare and Friends programs. So Medicare, as we know, is national health insurance, and most people associate it with folks 65 years old and older. But Medicare can be provided to people younger if they're on Social Security disability for a couple of years, or they have end-stage renal disease or ALS, Lou Gehrig's disease. So those are the main types of governmental type insurances folks can have. And this, we're not going to talk really a lot about employer group plans, because many people who retire from the military, if they join early and they do their required years to be a military retiree, then many of those folks just, too young to retire and go fishing. So they have full-time jobs, and they may well have employer group insurance in addition to their national benefits.
Thank you, Susan. I have a quick question that I get a lot. And just it can be kind of, with the ship counseling and the Medicare side, sometimes we don't understand the VA priority levels or the priority groups that you mentioned. Could you give a few examples or a little bit more information on kind of how that works?
Sure. I'm going to switch over here and share my screen now, so we can see this. This is from the va.gov website. So you'll notice here it's the U.S. Department of Veterans Affairs. So this is the PACT Act is kind of a new thing. It does give a whole new set of veterans access to some extended benefits, depending on when they served and what the disability was. But let's look at the priority groups. So they assign priority groups based on the military history, your disability rating. You may or may not know that you can be a percentage disabled per the VA, or you can be 100%. So there is certainly a range depending on your medical condition. Your income level. So people who have lower incomes, are higher up on the priority group. Whether or not you have Medicaid, which is a federal and state program for folks who have lower income and lower assets. And if you're getting other benefits like a VA pension. The highest priority group are those folks with service-connected disabilities. So priority group 1, if you have a disability that's 50% or more and makes you unable to work, or you're a Medal of Honor recipient. Priority 2, if you have a service-connected disability that's less than 50% in the 30 to 40% disabling range. 3, if you're a former prisoner of war, you're a Purple Heart Medal receiver, if you were discharged from the military because of a disability, or it got worse because of your active duty service. If you have a service-connected disability at 10 to 20%, or you were awarded a special eligibility class. 4, if you are getting VA aid and attendance. VA aid and attendance is a little known benefit to veterans, and it can pay for or provide some in-home care, which as we get older and the funding sources are not as available these days, it's really good if you're a veteran to check out to see if you qualify for VA aid and attendance. If you're catastrophically disabled, it's along with there with group 4. Group 5, you don't have a disability, but you have a lower income and you're getting VA pension benefits, or you're eligible for Medicaid. 6 is depending on your disability rating or your general service history. So you may be in a group 6 if you have a disability that's service connected, but it's a 0% disabling condition. You participated in this project, you were in World War II during certain years, or the Persian Gulf War, or at Camp Lejeune during certain times of the year that you can see here. And just remember, you can find all this information yourself at va.gov. It's a super easy website. There's some other conditions where you may have be assigned in priority group 6 around being exposed to toxins. That's fairly new with them over in the Middle East wars. Let's move on here to 7. It is for folks who have more limited income. And for 8, if your gross income is above the VA limits, and you would probably be paying some co-pays for your services. And remember, these priority groups can be fluid because it is budget dependent, and it can change. Your income may change. Your physical condition related to a service-connected disability can change. So these are also fluid by your own personal circumstances. I'll stop sharing and we'll go right back to our presentation. Okay, we'll go to the next slide. There we go. Now, Medicare and VA. Well, they're friends, but they're not necessarily besties, and they don't supplant one for the other. So Medicare does not pay for services that you may get at a VA facility. Now, the VA generally doesn't cover services outside of the VA, but with pre-authorization, they may cover your treatment in a non-VA facility. But it's important to remember, we talk about networks a lot with Medicare and healthcare in general. The facility in which you get your services needs to be a VA in-network facility. It might not be a VA facility, but it does have to be in-network. And you have to get pre-authorization. And it's important to remember that the VA coverage is not like a supplement or Medigap plan where it pays the co-pays, which is a fixed dollar amount, co-insurance, which is a percentage, nor the deductibles associated with Medicare. It doesn't act like that. They are still two kind of siloed options to get Medicare or to get your health care. And just remember, they are completely different systems. They're all under that federal umbrella, but we have VA over here and we have Medicare over there. So you really need to think about, when you're approaching Medicare, what you want to do about VA benefits, depending on your priority level, perhaps, and picking up your Medicare. If you're eligible for Medicare and you don't sign up for Part B when you're eligible and you have no other credible health care, then there will likely be premium penalties that will last you a lifetime. And you will also be restricted into when you can sign up for Medicare. So a lot of veterans that I meet will say things like, and Melanie, you can pop in here too with your experiences. I go to the VA. I love the VA. I get great care there. Why do I want to pay the Part B monthly premium when I'm never going to use it? And that is a very valid question. And it all comes down to people's preference, how much flexibility they want in provider selection. But just remember, if you don't sign up for Part B when you're eligible and you have no other credible coverage, and remember, VA healthcare is not considered credible coverage for Medicare, you will be restricted to when you can sign up. And then for every 12 months you went without, you will be assessed a 10% monthly premium penalty, which lasts the rest of your life. And the only time you can sign up for Medicare if you've passed this period is the first 3 months of the year. So there is some risk there, but we understand if people just say, no, thanks, I'm counting on the VA to provide all the coverage that I need. We don't judge. We don't tell you what to do. We just want to make sure you understand what your options are. Now, if you need emergency care and you go to the VA hospital, and you go to a non-VA hospital, that's a big old error there. You may be responsible for the hospital bill, because if you don't meet their criteria and get pre-authorization and meet some other things, Remember, the VA doesn't pay for out-of-network providers unless certain conditions and circumstances exist. Another thing to consider, if you have TRICARE for Life, remember that's for retired military folks, you do need both Medicare Part A and Part B for your TRICARE for Life benefits to work. And I will tell you, this has got to be one of the most comprehensive, most affordable ways to go when you're eligible for Medicare and TRICARE for Life. TRICARE for Life kind of acts like a Medicare supplement or Medigap plan, but you don't pay for it. You've just paid for it all of those years that you devoted to serving our country. Another thing to think about, if you are the spouse of, or the child of, or the widower of a disabled veteran, you may be eligible for something they call CHAMP VA. And it is good coverage as well that works along with Medicare. So that's something to consider additionally if you meet those criteria.
Thank you, Susan. So we had one question come in, and it goes along with you talking about CHAMP VA. So Jerry asks, can a veteran spouse or surviving spouse get VA health benefits? So can you clarify maybe the difference between CHAMP VA and then the health benefits?
I can, and I am going to actually go ahead and share my screen again.
Okay.
All right, and we're going to look at this CHAMP VA benefit. Now, you'll notice I am no longer on a va.gov website because I wanted to show you this other website that's sponsored by the Medicare Rights Center, and it's called Medicare Interactive. This is it's technically non-governmental, but they really offer some quality information in an easily understood way. So let's look at CHAMP VA a little more closely. If you are the spouse of, and as in Jerry's situation, of a veteran who has passed away, you may be able for CHAMP. This is for people who do not get TRICARE nor TRICARE for Life. You can't have both. So you qualify if you are the spouse of a veteran with a service-connected disability, or you're a surviving spouse who died from that service-connected disability, or who at the time of their death was permanently disabled from that service-connected disability, or you're the surviving spouse who died in the line of duty of a service member who died in the line of duty that wasn't due to misconduct. Now, a service-connected disability is determined by the VA, and as we've talked about before, there's all kinds of ranges for those in the percentages. And of course, you have to actually apply for CHAMP VA. And you do that through the VA, and you have to be eligible for Medicare. There are some date issues around this, but generally speaking, people we meet today, they get CHAMP VA benefits if they meet those conditions along with their Medicare. But remember, just because you get CHAMP VA, it doesn't mean it's going to be different in the regular VA benefits, because Medicare does not pay for care that you receive at a VA facility. And you get your drug coverage through CHAMP VA as well. And we're going to talk about drug coverage and basic VA benefits. So Medicare Interactive, solid website. SHIP counselors use it all the time. But here's the VA, and it just kind of talks about the same thing. So I encourage you, Jerry, for very specific information to visit this website. If you're not into reading a website, you can always call, and we have the number for you at the end of the presentation, the VA, and talk to a real person. There's also these terrific people called county service officers. And no matter what county you live in, you're going to have one or two, or sometimes three or four, depending on the size of your county. And they're people with in-depth knowledge of VA benefits, and they are a terrific resource. I always find them a really good resource about the aid and attendance benefit. I don't know about you, Melanie, but those county
Mhm.
service officers are gold.
They are, and they're very good about sharing ship information too. So they
Right.
are a full service.
Yeah.
Absolutely. Okay. So I think we're going to talk about this next, but we did have a question in the chat about the credible coverage with VA benefits and prescription drug coverage. So I just kind of want to do a quick reminder that, we have talked about the health benefits so far. So when we kind of say that the VA benefits are not credible coverage for Medicare, we're talking about Medicare Parts A and B. So I think our next slide, if I'm not too far ahead of myself, we're going to talk about the prescription drug coverage and how that may differ. Okay.
There we go. Okay, so now this is a way Medicare and VA are still not working together, but this is a way that you can have fabulous coverage and access to two different formularies. So I can't imagine there would be too many medications out there that wouldn't be covered under one formulary or the other. And a formulary is the list of medicines that an insurance covers. So the VA has a terrific formulary, but there are some things that are not on there. And so some people do combine Medicare prescription drug benefits with the VA formulary and the services you can get for prescriptions drugs through the VA. But you can't just like call up the VA and say, I'm coming to your pharmacy. Here's my scripts from my doctor outside the VA. That doesn't fly. You have to have been examined by a VA doctor. The VA doctor has to have prescribed those medications. So it provides greater flexibility, but you still have to go by the rules of both Medicare and the VA. And you can have both at the same time. And you can even say, when you're first eligible for Medicare, no, I think the VA is going to cover my prescriptions very well. I'm not going to sign up for Part D of Medicare. And because Medicare considers VA prescription coverage credible or creditable, you would not have a additional penalty to pay should you choose to sign up for a Part D plan. Now, you do have to go by Medicare's rules on when you can get a new Part D plan. It's around the annual enrollment period, some special enrollment periods. But there wouldn't be an extra premium penalty attached just because the VA drug coverage is considered credible by Medicare. So some other things to think about when you're deciding whether to have both VA and Medicare or just one or the other coverage. VA's cost of drugs is depending on your priority level. We talked about those 1 through 8. And we talked about, I mentioned flexibility really quickly. You can have both and you can just see where your drugs are going to be cheapest and maybe sometimes more convenient. It might not be terribly convenient for you to drive to the VA hospital to get your prescriptions unless you have a clinic in your town. So that's how we do work. Medicare does work with the VA, and we consider their prescription drug coverage credible. And I know quite a few veterans, because there are some really low monthly costs of Part D plans these days, that they do have both, just to maximize their flexibility.
Absolutely. Thank you, Susan. And I think that sometimes with the VA benefits and the drug coverage, you can get mail ordered as well. So for some folks that are in more rural areas, that is something that you could look into as well.
Right.
So I had a question texted in, and it was more about when we were talking about how VA and Medicare, the health benefits don't necessarily coordinate. VA works within the VA, Medicare doesn't. Medicare works outside of the VA doesn't. So for folks that have VA benefits and are on Medicare, um, would they need to consider a secondary coverage for their Medicare outside of the VA?
Well, it just depends on individual choice. you know, many people want to be able to have maximum flexibility and to access services however and wherever they want. And maybe they'll want to go to the VA for certain things, but maybe they'll want to go to a different specialist or a different place outside of the VA. And for that, you would use your Medicare benefits. And if it's an outpatient thing, that's that Part B, which you have to pay for each month. And then some people do have Medigap plans that they pay an insurance company to have the extra insurance, or they take their Medicare benefits and enroll in a Medicare Advantage plan, which is a managed care way to get your Medicare benefits. You can use both at the same time if that's what you want to do. It's not necessarily an either or as far as your choice, because as a Medicare beneficiary, you have rights, you have access to options. As a veteran, under certain conditions, you have rights and you have access to options.
Awesome. Thank you. That's what I was hoping you would say, and
Yeah.
you nailed it. So, and we did just have a question come in the comment section about, can a veteran with VA benefits have an Advantage plan? And you just said yes, they can. So
Right.
I think we've got our questions caught up here.
Yeah.
So let's see if I can click right here. And let's talk about affording Medicare and some things about that.
Yeah, we've talked about Medicaid because it does come into consideration when you're assigned your priority group under the VA. But there is an interesting and very helpful Medicaid program that's available to Medicare beneficiaries that allows folks to have more income and more assets than traditional Medicaid. So if you are a person and you make less than a single person gross, less than about $2,400 a month, and you have less than about $9,100 in cash assets, then you may qualify for a Medicaid program that pays that Part B monthly premium. And there are other programs that might pay for all of your healthcare costs if you make a little bit less money. This is something that SHIP counselors are glad to talk with you about and even help you with an application. There's also a program called Extra Help that helps pay all or most of your prescription drug benefits. They will lower the cost of your expensive medicines. They can cover your Part D monthly premium if you have a Part D plan. And so you can use all of these terrific programs along with your VA. So you can access your Medicare benefits outside the VA and get what you can get from the VA. But it's nice to know your options, and it's great for somebody local that you trust that can help you fill out these applications. They're super easy.
Thank you. Absolutely. We've seen a lot of folks really get a great benefit out of these programs. And we've touched on a lot of these resources already. But go ahead and, if you don't mind, share with us some of these ways that folks can get more information about what we talked about today.
Sure. So we already took a quick peek at the va.gov website, which does have that little magnifying glass, which means you can just type in some keywords in there and then the topics will come up for you. You can also call them at this toll-free number. Now, in Indiana, like I said before, each state has their own Department of Veterans Affairs, and here is their contact information as well. And then that will pop up a list and a map of all of your county service officers, which we think are those terrific people, kind of like SHIP counselors, but they know all about the VA and all of the services and how you can access them. And many times they can help you with some applications as well.
Absolutely. And we don't have that on our list, but we did take a little field trip over there to the medicareinteractive.org website. And I did go ahead and type that into your comment section. So if you're
Thank you.
interested.
Hey, Melanie, I did want to cover just one super quick thing.
Okay.
Earlier, we talked about under certain circumstances, the VA will pay other providers. And
Yes.
I want to talk about, because really what comes to mind is What if you're someplace and you have a true emergency, a medical emergency, and you can't get to the VA? How will the VA cover that emergency room service? So, of course, they have conditions on this. If that issue, your medical issue, is life-threatening, you do not need to get pre-authorized. You can go to an emergency room, but it has to be an emergency room in a hospital. Then that provider, or in fewer circumstances, and they don't prefer this, a trusted family member or friend, must notify the VA right away within 72 hours. And, going into the emergency room is already catastrophic enough, but to make sure that this notification is done is another stressor for you and your family members. You have to meet certain eligibility requirements. You have to be already enrolled in VA healthcare. You have to show that the VA facility was not feasibly available, which really means it was too far away, and that emergency care was needed. And there's a couple others too, that requirements that you can find on va.gov. And they're only going to cover services in that emergency hospital until they can safely transfer you to a VA facility. So, but say it's not like a heart attack or something that is truly, truly life-threatening, but maybe you have an acute, serious illness that you need treated at an urgent care center. Something like stitches or an ear infection or something like that, that really needs medical treatment, but you're not close or unable to get into your VA. So for urgent care, you can get urgent care at most VA facilities, or you can get urgent care at a center that's in network with the VA. And you remember, you have to already be enrolled in the VA healthcare program, and you have to have received healthcare from the VA within the last 2 years. For them to potentially cover that urgent care center. But you always want to make sure that they are in network with the VA healthcare coverage. Not always an easy thing, but it does behoove you to make that one more call.
Mm-hmm. Thank you for clarifying that, and a very important topic and something to know, because when you're in that situation, you're more concerned about getting your health needs met at that moment, but we also want to avoid those high medical bills if we can. So absolutely very important topics. So thank you for going back and covering that. All right. Well, I think we're caught up on our questions. Was there any other information that you would like to share with us today?
Well, here's a general information slide for you to learn more about Medicare. Some great websites, and of course, our great website and our telephone number. So feel free to call us and get connected with a SHIP counselor near you.
Absolutely. Yes. Okay. Well, so this kind of wraps up our July Facebook Live presentation. So we ended the month with our first Medicare and Friends series, and then we're going to start August and continue our series with Medicare and Friends. So we're going to talk more about the coordination between Medicaid and Medicare. So we will be covering that important topic and understanding just how those two work together. And I don't know, I guess we could almost call them besties in some sort of way, because they do actually, you can use them together and coordinate, unlike the VA. So we're going to kind of dive into that a little bit more. And then we'll our What to Know Wednesday, we're going to talk about Medicare's preventative services and all of the preventative care that is covered under your Medicare Part B benefit and your Part D benefit. So we're going to go through all of those items so that you can be on top of your care and take advantage of those things that are offered to you for free to help promote a healthy lifestyle. And then we're going to end our month on the 19th with our Medicare and Monday. And we're going to continue our series of Medicare and Friends. And that topic is going to talk more about employer coverage, whether it's large group, small group, retirement, and some other types of health coverage under kind of that same umbrella that would coordinate with your Medicare. So we are excited for August. We're excited about these informational topics. And just like our July presentations and any of those beforehand, they are all saved on our Facebook page. So if you're unable to join us live, you can go directly to our Facebook page under our videos section and find a library of our presentations. And we also have a YouTube channel. So our YouTube channel, if you type in Indiana State Health Insurance Assistance Program or Indiana SHIP, you will be sure to find us. And most of our Facebook Lives are on there as well. Sometimes it takes us a little bit to catch up, so you may not see our most recent ones, but we do try our best to keep that up to date as well. So without further ado, I think we'll see everyone on August 5th. And we hope you have a great rest of your week, a great rest of your July, and we'll catch you in August.